The Joint School of Public Health redefines the traditional approaches to academic public health by demonstrating a cohesive model of collaboration beyond structural and cultural boundaries of multiple institutions. By integrating the expertise and resources in public health from ODU, NSU, and the former EVMS, the Joint School of Public Health is the only academic partnership of its kind in Virginia. This partnership demonstrates a shared identity and enhanced visibility for public health education, research, and community engagement between Old Dominion University and Norfolk State University.
Public health is changing, and it's changing fast, especially for this region here in eastern and coastal Virginia. We have new issues like climate change, rising sea levels, sinking aquifers. We have new mosquitoes that potentially can bring new diseases. And we have huge disparities in terms of health outcomes between our different populations, our different neighborhoods that really need to be addressed. Having a school of public health will really help us address that change. We really need a partner in academics, in research, to be able to help us move forward.
Communities in Hampton Roads face complex health challenges in health disparities, including lower life expectancy, smoking, obesity, preventable hospitalization, diabetes, hypertension, firearm-related injuries, and stroke. It's important for us to engage our community partners across multiple sectors to address social determinants of health and generate collective impact at the societal level. Both Old Dominion University and Norfolk State University have long-standing community relationships.
They've worked with the Chesapeake Health Department doing a benefit on a baby care program. At the Norfolk Health Department, the public health program was helping us evaluate a project that's being funded on community violence.
Community engagement is something that is a foundation of all schools of public health. As a joint partnership for the school, we're just getting started with how we're going to conduct community engagement, building off of the experience that ODU has and Norfolk State has as well.
Coming from the perspective as an alumnus of the joint MPH program at EVMS and ODU, students have the opportunities to collaborate more with faculty and staff, as well as community members, nonprofit organizations, health systems. What we are doing with the joint school is building upon prior success in Hampton Roads. We have a lot of great anchor institutions here, our hospital systems, our health departments, our community-based organizations. So being able to have a structure with the joint school to be able to enhance collaboration amongst those partners is really going to go a long way for addressing health disparities in our area.
The Joint School of Public Health is a combined force of health specialties and public health tracks that are student-focused and can reach students worldwide. It provides the flexibility to our schedules while maintaining high-quality standards. Every effort is put into the student's success, so we're able to expand the public health sector and bring them to our communities worldwide. My career aspirations are to use the knowledge, resources, and relationships built in this program and apply them to the military and civilian public health sector and make them interoperable. With this joint effort of communication, we are able to be a better guide for future military students and members in pursuing their interests and opportunities in public health as well.
Public health is changing. The whole world is having a new look of what we can do and how we can help communities. We're in a phase called Public Health 3.0, which really looks at social determinants of health. Things like poverty, literacy, race, ethnicity. Another thing that's particular for this region is what we call disparities. Those are the differences in health outcomes between different communities, specifically our African American and our white communities. The health issues and disparities are demonstrated by data and by the communities themselves. Food insecurity, housing insecurity, mental health crisis, community violence, drug overdose, and chronic diseases that affects our population. We need to do things differently. We cannot rely on how we used to do public health, and the Joint School is going to help with policy development. Here in Hampton Roads, we have a huge opportunity to use research to structure ways that we can inform policy. We need the public health school to help us identify which policy can be changed and to chart that course. It's a domino effect. If one health district or one community, one neighborhood begins to say, hey, we were listened to and we had an idea and that was put forward and now it's published, the next one is going to want to have that same experience and we're going to learn from each other.
Through these partnerships, our school will offer transformative educational programs to train the next generation of public health workforce, conduct innovative research to inform public health practice and policy community about evidence-based strategies to address health disparities, and make actionable data available to communities for guiding public health practice and interventions.
People in this area are very excited for the partnership and to have a School of Public Health for that reason, like to bring best practices related to public health, to bring a dedication and focus and passion for public health, focus on the environment, focus on maternal and child health, focus on advocacy, focus on communications that we may not have had as much as we need to in this area. There's a lot of opportunity to have a positive impact on the world, which a lot of students are looking for.
The Joint School of Public Health brings a huge opportunity to consolidate our knowledge, our practices, our resources. We can work together, work with the school to really help define where we're going to go and what's going to be best as we bring the communities in to define these solutions together.